your dog's not breathing, what do? I'm going to show you how to perform CPR. So the first thing you need to do is check your surroundings for any dangers. You're going to try and see if you can wake that dog, say the dog's name, give them some gentle movements, try and see if you can rouse them. If not, you're then going to remember the 3 letters, A, B, C, airways, breathing, circulation. First of all, airways. Open the mouth, pull the tongue out to the side and see if you can see anything blocking the airway. If you can, use a sweeping motion to try and dislodge it and not push it down further. Then you're going to move on to B, breathing. There's a couple of things you can do for that. You can put your cheek to the nose to see if you can feel for any breaths. Or you can look and feel if you can see or feel any rising and falling of the chest. If that's a no, you're going to move on to C, circulation. So using your 2 fingers, put them on the inside of the thigh and see if you can feel for a pulse. If you can't feel a pulse, then you need to perform CPR. The first thing we're going to do is perform 5 rescue breaths. So the way we do that with large dogs, we seal the mouth, keeping the tongue out, and we put our mouth around the nose, making sure the slits at the side are covered. In a small dog, it'll go around the entire snout. And then we're going to deliver 5 breaths. They're quite slow, about 1 second long each, so they're not fast breaths. And we're going to check to see if we can see that chest rising and falling. So I'm going to perform the 5 rescue breaths. Then we're going to move on to the chest compressions. So where we do these depends on the breed of the dog. In deep-chested dogs, we'll do them where the heart is. So if you pull back the arm, where the elbow naturally sits is where their heart will be. And then in your round-chested dogs, such as Labradors, Golden Retrievers, they'll have this sort of mound where the rib cage is, and we'll perform it there. We're going to use the flat part of our palm, and we're going to interlock our fingers, keeping our arms completely locked and straight. Put the hand over the heart or over the rib cage for those round-chested dogs. Lift up onto your knees. We're going to then perform 100 to 120 beats per minute. So if you do that to the tune of Staying Alive, it's about 2 per second, and we're going to deliver 30 of those. When we're pushing down, we're aiming to push down for about 1/3 and 1/4 of the chest. And once you've done 30 of those, you're going to move back to the breaths, and we're only going to do 2 this time. Exactly the same as before, around the nose for the larger dogs, around the whole snout for the smaller dogs, 2 rescue breaths. We're then going to check to see if we can see any movement or breathing. If we can't, we're going to continue with that 30 chest compressions followed by 2 rescue breaths. We'll do that for 20 minutes or until help arrives or until you're completely exhausted. Make sure before you do perform CPR, you've called a vet. They'll be able to give you any extra advice. They'll be able to stay on the phone with you and also prepare the veterinary practice for when you arrive. You can keep doing this while you're travelling to the vets. But this could save a dog's life, literally. Make sure when you do perform it, the dog is fully unconscious, there's no breathing, you can't feel a pulse at all, so you're never performing this on a conscious animal. You can practice on a cushion or a teddy bear at home. And there we go, I hope it helps.